Med History.
What happened? A candle fell. The flame quickly spread and caught my blanket on fire. And then everything was engulfed in flames. Zaid translates his mom's speech from Spanish. When the incident happened, Zaid's mom speaks in Spanish. It was very painful for me, as no mother wants this to happen to her son. Doctors said I was at death's door when they brought me in. There was no hope at all. If you could change anything in this world, what would you change? I would change. I would want people to understand each other better. Do you feel misunderstood? Sometimes. How would you describe your role in his life? I would say I feel like a mentor, someone he can ask about anything and hear the truth. Once a boy said, he called me some creature from his imagination. I don't remember who exactly, but I remember what I did. I scared him, and he ran all the way home. And then my mom said, "Don't do that." And I said, "Mom, I found it funny though." Did you intentionally scare that boy? Well, yeah, sort of like that. I like how you have fun. Did it ever bother you, or do you just tolerate it? I tolerate it because now I understand children. Burn is tissue damage caused by local exposure to high temperatures, over 55, 60 C, aggressive chemicals, electric current, light, and ionizing radiation. According to the depth of tissue damage, 4 degrees of burns are distinguished. Extensive burns lead to the development of so-called burn disease, which is dangerous and fatal due to disorders in the cardiovascular and respiratory systems, as well as the occurrence of infectious complications. Local treatment of burns can be carried out in an open or closed way. It is necessarily supplemented with analgesic treatment, according to indications, antibacterial and infusion therapy. I-degree, incomplete damage to the surface layer of the skin. It is accompanied by redness of the skin, slight swelling, burning pain. Recovery is in 2-4 days. The burn heals without a trace. 2-degree. Complete damage to the surface layer of the skin. It is accompanied by burning pain, the formation of small bubbles. When the bubbles are opened, bright red erosions are exposed. Burns heal without scarring within 1-2 weeks. 3-degree. Damage to the superficial and deep layers of the skin. 3-degree. The deep layers of the skin are partially damaged. Immediately after the injury, a dry black or brown crust forms, a burn scab. When scalded, the scab is whitish-grayish, moist and soft. The formation of large, fusion-prone bubbles is possible. When opening the blisters, a mottled wound surface is exposed, consisting of white, gray, and pink areas, on which a thin scab resembling parchment is subsequently formed during dry necrosis, and a moist, grayish fibrin film is formed during wet necrosis. The pain sensitivity of the damaged area is reduced. Healing depends on the number of preserved islands of intact deep layers of skin at the bottom of the wound. With a small number of such islands, as well as with subsequent suppuration of the wound, independent healing of the burn slows down or becomes impossible. The severity of the burn, the prognosis, and the choice of therapeutic measures depend not only on the depth, but also on the area of the burn surfaces. When calculating the area of burns in adults in traumatology, the Palm Rule and the Rule of Nines are used. According to the Palm Rule, the area of the palm surface of the hand corresponds approximately to 1% of the body of its owner. According to the Rule of Nines, the area of the neck and head is 9% of the entire body surface, chest 9%, belly 9%. The posterior surface of the trunk is 18%, one upper limb 9%, one hip 9%, one shin together with the foot 9%, external genitalia and perineum 1%. The child's body has different proportions, so the rule of nines and the rule of the palm cannot be applied to it. The Landa and Brower table is used to calculate the area of the burn surface in children in specialized med. The total area of burns is determined using special film meters, transparent films with a measuring grid. Forecast. The prognosis depends on the depth and area of burns, the general condition of the body, the presence of concomitant injuries and diseases. To determine the prognosis, the Lesion Severity Index (ITP) and the Rule of 100 PS are used. The severity index of the lesion. It is used in all age groups. With ITP, 1% of a superficial burn is equal to 1 unit of severity, 1% of a deep burn is equal to 3 units. Inhalation lesions without impaired respiratory function, 15 units with impaired respiratory function, 30 units. Prognosis: favorable, less than 30 units. Relatively favorable, from 30 to 60 units. Doubtful, from 61 to 90 units. Unfavorable, 91 or more units. In the presence of combined lesions and severe concomitant diseases, the prognosis worsens by 1-2 degrees. Rule of the 100. It is usually used for patients over 50 years of age. Calculation formula: the sum of the age in years plus the area of burns as a percentage. The burn of the upper respiratory tract is equated to 20% of the skin lesion. Forecast: favorable, less than 60, relatively favorable, 61, 80, doubtful, 81, 100, unfavorable, more than 100. First aid. It is necessary to stop contact with the damaging agent as soon as possible: flame, steam, chemical, etc. In case of thermal burns, the destruction of tissues due to their heating continues for some time after the termination of the destructive effect. Therefore, the burned surface must be cooled with ice, snow, or cold water for 10-15 minutes. Then carefully, trying not to damage the wound, cut off the clothes and apply a clean bandage. A fresh burn should not be lubricated with cream, oil, or ointment. This can complicate subsequent treatment and worsen wound healing. In case of chemical burns, it is necessary to rinse the wound abundantly with running water. Burns with alkali are washed with a weak solution of citric acid. Burns with acid with a weak solution of baking soda. A quicklime burn cannot be washed with water. Vegetable oil should be used instead. In case of extensive and deep burns, the patient must be wrapped up, given analgesic and warm drink, preferably soda salt solution or alkaline mineral water. A burn victim should be taken to a specialized medical facility as soon as possible. Institution. Treatment: local therapeutic activities. Closed treatment of burns. First of all, the burn surface is treated. Foreign bodies are removed from the damaged surface, and the skin around the wound is treated with an antiseptic. Large bubbles are pruned and emptied without removing. The exfoliated skin adheres to the burn and protects the wound surface. A burnt limb is given an elevated position. At the first stage of healing, drugs with analgesic and cooling effects and medicines are used to normalize the condition of tissues, remove wound contents, prevent infection and rejection of necrotic areas. Aerosols with dexpanthenol, ointments, and hydrophilic solutions are used. Antiseptic solutions and hypertonic solution are used only in first aid. In the future, their use is impractical, since bandages dry quickly and prevent the outflow of contents from the wound. In case of burns of the 3 degree, the scab is preserved until the moment of self-rejection. First, aseptic dressings are applied after rejection of the scab, ointment ones. The purpose of local treatment of burns in the second and third stages of healing is to protect against infection, activate metabolic processes, and improve local blood supply. Medicines with hyperosmolar action, hydrophobic coatings with wax and paraffin, are used to ensure the preservation of the growing epithelium during bandages. In case of deep burns, necrotic tissue rejection is stimulated. Salicylic ointment and proteolytic enzymes are used to melt the scab. After cleansing the wound, skin grafting is performed.